Hi everyone, Minik Lesser here. Thank you so much for your discussion and feedback this week, and thank you to my opponent Stephanie for making this a great debate topic. Now let's discuss nursing skill mix. Imagine for a moment that you're the charge nurse on a 30-bed surgical unit. You have 15 fresh post-ops, but 10 patients are ready for discharge and 5 are ALCs. How many RNs do you need? Now imagine you're the charge nurse for a 50-bed wing at a long-term care facility. Every resident is stable, except for one who's actively dying. Now how many RNs do you need? Is making the skill mix the same in both of these scenarios the best choice? Let's explore this. So here's what we know. We have the highest shortage of nurses ever in our healthcare system, and it's on the brink of collapse. We know this because we're actively living it. We must immediately maximize the skills and scopes of all licensed nurses to meet the needs in all settings. There is a finite number of RNs, and although my opponent would advocate for evenly distributing RNs across all settings, or give you the impression that RN ratios are unjustly skewed toward acute care, I'll ask you this. If an emergency department had a total of 40 RNs and 10 LPNs, and a nursing home had a total of 46 LPNs and 4 RNs, do you really want to redistribute this so that both have 22 RNs and 28 LPNs? Of course not. It doesn't make sense. The only way to increase the number of RNs in long-term care without jeopardizing the patients in acute care is to hire net new RNs, which comes with a cost. So then what is the right skill mix? How do we determine this? The answer is not simple, and it can be different for the same unit on a different day of the week. It all depends on these three things. The client. What are their needs? How complex are they? The staff. What are their skills? What are their competencies? What about their scope of practice, their past experience? And then there's the organizational factors. So what is the environment like? What is the care delivery model? Is there leadership and support? What about organizational policies and procedures? It should be clear now that many factors influence what the right skill mix is, and it's not just about making the numbers the same in all settings. So let's again imagine that 30-bed surgical unit and that 50-bed long-term care unit. Do you still think that the skill mix should be the same? Thank you so much for your time and consideration.